Thank you, Wendy. Thank you guys for being here. This is very exciting. We have great speakers, great talks lined up for today and obviously tomorrow and Friday. As Wendy and Dr. Hanel said, this is very exciting because this is an opportunity for us to really talk about what we do. And also, I want to appreciate all the work that you guys do. When it comes to patient care, it takes a village to do what we can do. And as you know, as Cerebrovascular Center, we deal with very complex issues. I'm going to go over one of our patients who's here with us today. But I think the important thing is you guys make a big impact on patient life day to day. So thank you for all your hard work for whoever's here and whoever is not here. And at the end of the day, I hope you guys enjoy the conference. And I hope that you're able to enjoy the area as well. So I would like to just present a few slides. And this is just a sample of what Dawn went through. If I'm not mistaken, Dawn was 46 years old and so young. And she's a nurse. And she didn't have any risk factors. First time I met Dawn was with this. I happened to be on call and Dawn came to the hospital with severe headache and then she further deteriorated. As you know, we get brain imaging and on the scan initially that we got, you can see that there's some bright spots right in the middle. So she had subarachnoid hemorrhage. Now, as you know, and as you hear through the talks today, stroke is very common. It happens all the time. And it's an emergency, right? So we're very fortunate to be able to treat both ischemic and hemorrhagic strokes. But this is an emergency. So what do we have to do? Well, first thing we had to do, airway breathing. She did have hydrocephalus. So the team, we inserted a drain to relieve the pressure. I don't have any picture of that. The second thing we had to do was identify the source of bleed. On top, this is what she had. So this was a more complex aneurysm. You can see that where the arrow is pointing, it had two things bulging out. And so that we had to seal that. And you can see the bottom that we were able to plug it in. And we actually put a flow diverter at that point to get rid of the aneurysm and seal it with coil. So we put a drain in, we've sealed the aneurysm, right? Doesn't stop there. So what's next? Well, this was done. And I think you guys, a lot of you can, this is familiar, right? We have patients like this in our ICU quite a bit. But after we did those initial things, I was her in the ICU. Ventilator, there's so many drips that, to be honest, I don't know all the drips that is going on. There's so much going on, but the nursing, the mid-levels, the staff, it really does a great job of taking care of patients such as Dawn. However, Dawn course was complicated, and we're fortunate again that we have a multidisciplinary approach to what we do. She had more bleeding in the brain. She actually needed a craniotomy. My partner, Dr. Savageau, and actually Dr. Hanel, who's here, took care of the surgical part of it. She needed a lot of medical management. The neuro ICU did a great job taking care of that. So fast forward to, this is another picture. She got the trach. So that was a prolonged hospitalization. She was in a neuro ICU, if I remember correctly, for 1 month. This is another picture that she did have. But at the end of the day, she was able to slowly recover. After a month in the neuro ICU, in a coma, she started walking. Wade is here with her. I do want to highlight Wade. He kept me in touch about how Dawn was doing, and he was at her side the whole time, and he was a big support. With that, I would like to introduce Dawn and Wade to come here and tell us a few words.
Ooh, said I wouldn't get emotional, but man. there's not just trauma with her, there's trauma with me too. Well, if there's one thing Florida does really well, it's air conditioning. It's freezing in here. So I'm usually wanting more AC, but no, first of all, I'd like to say it's an honor and a privilege to be here. Forgive me, we promised we wouldn't get emotional, but here we are, and it's always me, because I obviously had to see this and walk through it, even when Dawn doesn't remember what was going on. But, I think that, when you guys asked us to share and to speak, and I think the thing that really stood out to me was compassion, compassion for patients, compassion for families. I mean, you guys aren't just a doctor or CRNA or nurse or staff to Dawn. You're doing that for me as well. And so I think that compassion really stands out, and really having that level of care to go the extra mile. I can remember being up there on that first day and running, literally crossing through those ER doors, and Dr. Thieveridge was running towards me. And she said, "Come on, we gotta hurry." And at that point, I'm starting to freak out. And eventually, I was unfortunately too late to see, Dawn go back into surgery prep. But I remember sitting up in the waiting room, and of course, COVID was going on. And I think it was the day before where visitation had stopped, right? So, so I was up there, very few people. None of my friends could get in, none of my family could get in. And so I'm just sitting up there, just bawling in the corner, and one of Dawn's coworkers was able to come in and be with me. But I remember Dr. Nima coming in. We stepped aside into a room, and he sat down and he showed me some of the pictures and what was going on. And I just, Dawn and I are Christians. We're longtime Christians, believers. And, I just remember the peace of God, flowing through me and over me. And I just remember going, I trust these people, and everything he told me, excuse me. There was never a doubt in my mind of the care that Dawn received. I guess is probably the easiest way to put it. There was never a doubt in my mind. There was never a moment where I said, I wonder if they're doing the right thing. I wonder if they should have done this or should have done that. They're not responding. I never had any of that. And oftentimes, unfortunately, you hear stories about that, about people being hospitalized and second guessing and questioning and all that, but never once. And so, you guys are heroes to me. You're heroes to Dawn, and the compassion. And Dr. Nima gave me a cell phone number, and when he said reach out anytime, he actually meant it. And fortunately, unfortunately, I've had to do that several times throughout this journey, because one thing that you learn is that it's not enough that you're just dealing with a brain injury, right? You're also dealing with all the secondary complications that come along with it, whether it be COVID or UTI, most recently that sent Dawn into seizures, back in July. So you're dealing with all these different things that come along with it. And so having access to some of the brightest and most compassionate people means so much to me and to us. So I just kind of want to talk about, which.
I don't know much to say about before everything, or at the very start of everything, because I don't remember a lot of that. But I know what to say in this last venture once I got out of the hospital, once I started recovery. I'm not a very patient person. I will be honest with that. A lot of you are probably patient, and that's not me. I was ready to get in fast forward recovery mode. So when I made it to recovery, they were asking, what do you want to do? And I was like, I want to get out of this bed. I want to start walking. Like, I was a nurse for 4 years. No, a long time, a lot longer than that, probably 20 years. 20 years? Yeah, my brain doesn't work like it used to, but it's coming back slowly. But I was a nurse for 20 years for pediatrics. So I knew I was better than pediatric. So I was like, I know I can recover fast, and I know I'm going to get this journey over with at some point soon. And they kept telling me it's not going to be like pediatrics. You are different. And I was like, oh. So slowly I became in knowledge of that, and I still rarely cared a smile on my face. I was like, "Urgh." But the doctors and everybody that dealt with me, you guys, I think I don't remember y'all as well as I remember myself. But I know that I know just because of where you had taken pictures and things that you had showed me later, I was like, oh my gosh, I went through a lot. I mean, I had never seen pictures of me with a vent in, and I was like, when I take care of people with vents, that's like not kidding. And when I was in the hospital for
2.5 months.
2.5 months in total, I was like, are you kidding me? How am I doing this? Like, how am I standing up here talking right now? But I really want to thank you. I want to thank you for all your nights of hard work, days of hard work. Having been a nurse and having done what you do, I think you're all excellent. I wish I could give you all the biggest hugs. I mean, I wish they'd just give me the rest of the day to just hug you all and let you know that I really do thank you for what you do. I never expected to be in this position.
And I think that's the thing too, is that, a lot of you have become like family. And, we go back up to Weaver 10 and walk around, and whether it's Anna Scott or, seeing Dr. Naval, I don't know where Dr. Naval is, but the smile and positivity is always contagious. I mean, just a, gentle and wonderful man. Dr. C, who took care of Dawn multiple times. I mean, there's just so many to name. Carly, chaplain that used to be here, Rick, and Alma, who would call me every morning at 5 a.m. after taking care of Dawn overnight. There's just too many to name, and I'm forgetting a lot of people because it truly took an army to take care of Dawn. And I think sometimes it was hard not being there, from my standpoint, because that she's being taken care of, that the patient is being taken care of at that level of care in the ICU. But as family, not being able to be there at that point because of COVID restrictions, you're left in the dark, and you're just waiting on those 1 or 2 phone calls per day. And so, whenever we get a call, it just meant the world to us, because I knew that Dawn was obviously in critical condition. And I knew that I'd rather you guys be taking care of her than trying to fill me in at the time. But at the same time, there's a balance, but that you're trying to strike. So again, having that level of care and having that level of compassion, to treat her like family, to treat me like family, goes a long way with patients, because you guys are really good at what you do, oftentimes in my job, when I've been hiring people, interviewing people, I always tell them, your resume speaks for itself. you're obviously can do the job. You're good at what you do, but are you a fit culturally? And culturally comes with all those things, you know, personality and determination, and, you know, are you willing to put in the extra mile? And so for you guys, you know, the lasting impression that you're going to leave on a family is how much did you, you know, comfort? How much did you inform? How much compassion did you show? And for us, it was overflowing.
Very true. Very true. Do we need to go now? Are we done? But I take too long. But I do want to just say, I thank you all for what you did for me, for getting me to this point. I feel overwhelmed with joy, and it's hard being on the nursing side of things and realize that I'm probably not going to go. I'm hopefully not going to go back real soon to take care of patients, but I'm open to it. I have a daughter, and she has just turned 5, right?
Yeah.
And I love her to pieces, and I'm open to being a homeschool teacher, but it's almost like getting nursing and getting a nurse. I want the best nurse for the job to take care of me. I want to be the best nurse to take care of my patient, and I want her to get the best teacher for her. So when you're dealing with all that, you just got to pray about it and hope to get all the right things. But I'm not talking anymore. I really appreciate it. I'm gonna let y'all have your day.
Thank you guys again for having us.